Metoprolol is a heart medication that works by blocking the effects of epinephrine on beta-1 receptors within the heart. This causes the heart to pump more slowly and with less force. And I wanted to make this video as a quick guide to get you to better understand the effects of metoprolol, the upsides it has, what and why it's used for, and how to get around some of those side effects that can be tricky. It's a video that you've been asking for, and I'm happy to finally address it, so stay tuned till the end. Hi guys, you've seen Arsalan Media Pharmacist here on YouTube, where I help you guys make better and more informed decisions about your health and wellness. So if that's something you're into, be sure to smash that like button below now. Also, while you're at it, hit that subscribe button too, and don't forget to follow me on Instagram for more behind the scenes. So without further ado, let's get straight into it. Metoprolol is available as two different salts. You got metoprolol tartrate, brand name Lopressor, and metoprolol succinate, brand name Toprol XL. They're both used to lower high blood pressure and reduce chest pain, otherwise known as angina. Now, metoprolol tartrate can also be used to treat and prevent heart attacks, while metoprolol succinate is also used to treat heart failure. And it's totally okay to also see as a combination therapy too, with a water pill for boosted effects, either with hydrochlorothiazide or chlorthalidone. And you may also see it used to prevent migraines, treat irregular heartbeats, and it can sometimes be used to reduce your symptoms if you have too much thyroid hormone in your body. Both versions of metoprolol belong to a class of drugs you may have already heard of called beta blockers, and like other beta blockers, metoprolol works by changing the way your body responds to some of those nerve impulses, especially in the heart. And when this happens, it slows down your heart rate and makes it easier for your heart to pump blood around your body and decreases blood pressure at the same time. When the blood pressure is lowered, the amount of blood and oxygen is increased to the heart, and this resolves any chest pain and makes the flow of blood around your body run more smoothly. The best way to take metoprolol is how your doctor has told you to take it. There's so many different doses and variations that can be made with metoprolol based on different conditions. So the way you've been prescribed to take it is going to be the best way for you to get the most benefits from it. Strengths for the immediate release form range from 25, 37.5, 50, 75, and 100 milligrams. And strengths for the extended release range from 5, 50, 100, and 200 milligrams. And you'll see doses of the extended release for high blood pressure range at first from 25 to 100 milligrams once a day, and your doctor may adjust your dose as needed. However, doses really don't go over 400 for the most part. And for chest pain, it usually is 100 milligrams once a day up to no more than 400 milligrams per day. So because there's so many variations, following the directions given to you is crucial to get the best care. And on that note, it's important that you don't interchange immediate release and extended release forms of metoprolol. Always consult with your doctor before making any changes, especially when it comes to stopping metoprolol abruptly. Metoprolol has what is known as a black box warning, which is the most serious warning from the FDA. You should never stop taking metoprolol suddenly. If you do, you may experience worse chest pain, a jump in blood pressure, or even a heart attack. So if you're having side effects, which we'll address in a bit, first talk to your doctor, and they should be able to gradually decrease your dose or have you on an alternative medication. There are some medicines that may interfere with the way metoprolol works. Now, I've left a list of what those are in the description below, but the ones that stand out are the way it interacts with other medicines for high blood pressure, as a combination with metoprolol can sometimes lower your blood pressure too much, which may make you feel dizzy or faint. NSAIDs are another one, such as naproxen or ibuprofen, as these medicines may increase your blood pressure, so it's best to keep them to a minimum. Cough medicines that contain pseudoephedrine, amiodarone, and bupropion are known to interact as well. So talk to your doctor or pharmacist before starting out a new medicine or supplement. Now, it's totally normal for in the beginning of starting metoprolol to have it feel a little rough. If you're experiencing headaches, make sure you rest and drink plenty of fluids. And do not drink too much alcohol as well. And ask your pharmacist to recommend a painkiller. Headaches usually go away after the first week of taking metoprolol, but if you're feeling tired, dizzy, or weak, stop what you're doing and sit or lie down until you feel better. Don't drive or use tools or machinery if you're feeling tired. And again, avoid drinking too much alcohol, as this can make you feel worse. Another side effect that may be surprising at first is cold hands and feet. So my tips for this is put your hands or feet under warm running water, massage them, and wiggle your fingers and toes. You want to avoid smoking or have drinks with caffeine in it, as these can make your blood vessels narrower and restrict your blood flow. Mittens and warm socks can help too. Now, if you're feeling nauseous, stick to simple meals and avoid rich or spicy foods. It might also help to take your Metoprolol after a meal. Some even find this medicine to cause stomach pain. Try to rest and relax. It can help to eat and drink slowly and have smaller and more frequent meals. Putting a heat pad or a covered hot water bottle under your stomach may also help. But if you're in a lot of pain, speak to your pharmacist or doctor. Some bonus tips that I'll leave you with to keep in mind that I think are useful is: number one, if you're a diabetic, talk to your doctor about the possibility that Metoprolol may reduce symptoms of hypoglycemia. Number two, your doctor will need to regularly monitor your blood pressure and possibly other markers. Checking your blood pressure at home is an important way for you to keep records of how the medicine is working. I left a blood pressure machine that I recommend for you in the description below, so definitely check that out. I highly recommend sharing your reading with your doctor from time to time. Number three, always check that your prescription is correct, because there are so many variations. There have been a number of dosing errors involving Metoprolol tablets, so it's best to get to know your medicine to be one step ahead. Number four, your very first dose of Metoprolol may make you feel dizzy, so take it at bedtime. If you don't feel dizzy after that, you could start taking it in the morning. Nausea and dizziness are some of the most common side effects I hear patients tell me, so what has helped others is to take it after food. This will make it easier for your body to absorb the medication and may help you feel less dizzy and lightheaded. And number five, don't crush the extended release tablet. However, you can cut the tablet along the score marks, the groove on the tablet, if your doctor recommends a smaller dose. All in all, Metoprolol can be an effective way to manage high blood pressure, chest pain, and improve your quality of life and heart failure. And we know that it's safe to take for a long time. In fact, it works best when you do take it for a long time, so it's not something to be worried about in the long run. It starts to work about 2 hours, but it can take up to 1 week to feel the full effects. So with that, you may not feel any different when you first start to take it, but this doesn't mean it's not working. In addition to taking Metoprolol, it's also important that you make smart lifestyle choices like managing stress, eating healthier, and getting enough exercise. You can find my video I made on the upper right hand corner on lowering high blood pressure. I hope that this video helps give you a better understanding on Metoprolol. If you did enjoy it, subscribe to not miss out on all other future videos. Thanks for sticking tuned all the way till the end, and I'll see you on the next one.